Did you know that chiropractors can help people with wrist pain? We do all the time here at Wellness Key Chiropractic. First things first is figuring out what's causing the wrist pain to begin with. Is it poor sleeping positions, maybe repetitive injury, maybe it was a trauma. Whatever it is, we need to hear the history to figure out what's causing the problem in the first place. We're going to assess the 8 little tiny bones in the wrist, make sure that they're all moving properly. This one's not. And so first thing that I would do as a chiropractor is get that adjusted if possible. I could use my hands, or if it's not moving properly or the patient is so tender, I can also use an activator. Get in there and just getting more motion in those tiny little joints. Those joints are also often pulled on, tugged on by the muscles in the forearm. And so oftentimes after, I did some rock climbing recently or working with your hands a lot, forearms will get tight, and then a couple days later we'll start having some wrist pain and wrist issues. And so we'll have the patient, I'll find some trigger points. So I can look at the patient's face and say, oh, there's one right there, eyebrows raised. So I'll have the patient lift up their hand, I'll hold down that area, and then a little fascial release, working out some of those trigger points with my hand. We can give some freedom to the muscle, which will relax the tendons and ligaments as they go across the wrist, which will give the wrist some more freedom to heal and to repair itself. After the adjustment, we have a couple different options. Many of our patients like the dry needling that we do. So in the forearm, we find some of these trigger points. I leave them in there, perhaps even hook up electrical stimulation, and I can get those muscles actually firing properly instead of being under a constant state of spasm. That's going to release the wrist, reducing the wrist pain. If you're not a fan of needles, that's okay too. We have a PMF machine, also is going to reduce the inflammation and ultimately reduce the pain for the wrist and for the joint. And so this would be done for 15 or 20 minutes, typically before the adjustment. After the adjustment, go ahead and follow me. You would do some rehab on the wrist. This could be done at home, of course, as well. The same thing, working the ball across, lacrosse ball against the forearm on either side. And then a great stretch that we often have patients do is go ahead and take a seat for me. And then we'll sit down, and if possible, put the arms behind you. And with this vibration platform, we get a great stretch, vibration into the wrist. And again, you can vary the amount of pressure on that. That's going to reduce some of the pain in the wrist as well.